Good afternoon, everyone. First thing we're going to go over is some of the basic algorithms and codes. Now, all of these are located on the paymentimprovementinitiative.org website. So if you want to get a good look at these, and I would encourage you to do so, please go, and if you'll go to the website, go to the main page and click on the episode algorithm summaries and codes, and navigate to the ADHD code link. Any ADHD episode includes all ADHD-related care provided during the 12 months duration of the episode, including initial assessment. However, if the assessment is done later in the episode, the cost would be included in the episode. This includes the full range of services provided, for example, physician visits, psychosocial therapy, as well as medication used to treat ADHD. An ADHD trigger is any treatment listed with specific ICD-9 code, with the exception of assessment CPT code. That's the initial assessment that is included. For a full list, again, go visit our website and it will show you. We'll go through those slides in just a moment. The start of an episode for a new patient begins on the date of treatment initiation. For reoccurring patients, new episodes start on the first date of treatment after the previous episode ends, such as an office visit or prescription filled. The principal account provider, also known as the PAP, can be the PCP, psychiatrist, or licensed clinical psychologist. When a licensed clinical psychologist not associated with an RSPMI delivers the majority of care, he or she will require a co-PAP with the ability to write a prescription for medication. For version 1.0, the RSPMI provider organization will be the official PAP when listed as the billing provider. However, where applicable, the patient detail section of the report will be provided at the performing provider level. ADHD patients range in age from 6 to 17 without any behavior comorbidity conditions. There are 2 levels, which are determined by the provider certification that Patricia just talked about, which is entered via the paymentinitiative.org portal provider link. Level 1 are patients with positive response to medication management requiring only medication and parent-teacher administered support. Level 2 are patients for whom response to medication is inadequate and therefore psychosocial interventions are medically indicated. Each level will have its own threshold. This slide, again, is available on paymentinitiative.org from the home page. Click on the episode algorithm and navigate to ADHD codes. A Level 1 episode is triggered by either 2 medical claims with a primary diagnosis of ADHD or 1 medical claim and 1 pharmacy claim for medication to treat ADHD. A Level 2 episode is triggered by a completed severity certification, followed by either 2 medical claims with a primary diagnosis of ADHD or 1 medical claim and 1 pharmacy claim for medication to treat ADHD. The PAP assignment is determined by the billing provider with the largest number of claims within the episode. Where there are 2 PAPs for an episode, the positive or negative supplemental payments are divided equally between the PAPs. Based on the provider entry into the user-friendly portal and paid claims, the following measures will be tracked. Percentage of episodes classified as Level 2, average number of physician visits per episode, percentage of episodes with medication, percentage of episodes certified as non-guideline concordant, and percentage of episodes certified as non-guideline concordant with no rationale. Now, I will say that starting January 1st, developmental disabilities is considered a comorbidity and that would be excluded from the episode. Now, this will show you the codes that you'll need, and that, again, is on the paymentinitiative.org website. Okay, now let's look at the reports. PAPS will be provided tools to help measure and improve patient care. One of the most important tools is the provider reports. These reports are key to keeping up with your performance relative to each episode and show your eligibility for gain risk sharing. It is vital that you access and look at these reports as soon as they come out on a quarterly basis. It is very, very important. The reports provide performance information for PAPS episodes, such as an overview of quality across a PAPS episode, overview of cost effectiveness, how a PAP is doing in relation to cost thresholds and relative to other providers, and an overview of utilization and drivers of a PAPS average cost, episode of cost. PAP performance reports have summary results and detailed analysis of episode cost, quality, and utilization. A guide to the reading of the reports is available online, as Trish previously stated. Reports are issued quarterly starting July 2012. There were 2 reports issued in April. One was historical, covering data from January 1st, 2012 through December 31st, 2012, and one performance report covering closed episodes from October 1st, 2012 through December 31st, 2012. If you are an ADHD provider only, you will have only one report available for April, and that is an historical report. Any open Level 1 or Level 2 episodes will appear in the detailed section of that report, and we will look at that more closely a little later as we go through the reports. If you are a provider that sees patients in the URI episodes in addition to ADHD patients, you will have both a historical and a performance report. The performance report will show your closed episodes for the URI episodes, but will not show any performance data for the ADHD patients. Again, they will be shown in the open episodes on the detail of the historical report. Reports are available online via the provider portal. The delay between the reporting period and the availability of reports on the provider portal is due to the time required for the claims to be submitted for services provided. 3 months for 95% of the claims, and the time required for claims algorithms and quarterly reports to be processed, which is 1 month. Okay, the first page of the report will give you the date of the report and the date range included in the report. It will also tell you if it is historical or an actual performance report. The information contained in these, there is also a disclaimer at the bottom, and it says that the information contained in these reports is intended solely for the use of the administration of the Medicaid programs. The data in the reports is neither intended nor suitable for other uses, including the selection of a health care provider. And the figures in this report are preliminary and are subject to revision. And then it gives you our website again to visit if you have any for more information. The second page of the report is a letter from Andy Allison, our Medicaid director. There's a lot of useful information in this letter regarding the Arkansas Payment Improvement Initiative, so I encourage everyone to read the letter. One section of the letter that I would like to bring your attention to is in the fourth paragraph. In the first sentence, he tells you in the letter whether this is a report is in the preparatory or the performance stage. So I realize that as you're starting to view many of the reports, and sometimes it's a little hard to keep them straight, so this is another way that you can be sure what you're looking at is historical or actual live performance data. The third page of the report is your table of contents. This page will list all episodes for which you are considered the principal account provider. So in most cases, you will not have a table of contents that is this long. If you are an RSPMI provider, chances are it'll only show Level 1 and Level 2. You notice those are broken out in previous reports. They have not been. So This is new and different. You'll also still have a glossary and then the episode level detail. So again, it's only going to show those that you are the PAP for. The next page of the report is a performance summary. This page looks a little different from some of our previous reports, and I believe a little easier for you to read at a glance. Again, it will list all episodes for which you are a PAP, so chances are you won't be listed for all of these, so you might. But if you are an ADHD provider, like an RSPMI provider, you'll probably only have level 1 and level 2. Or if you treat URI, also you will have URI down at the bottom. Again, notice level 1 and level 2 are separated and are considered separate episodes as they have different threshold and quality metrics. In the next column, you have the quality of service, and it will show met or not met for any of the episodes. The next column is the average cost, average episode cost, whether it's acceptable, not acceptable, commendable. It will tell you where you are exactly with that episode, whether you are subject to gain or risk sharing. If you'll look on the upper respiratory here at the bottom, it says subject to risk sharing. So that will show you immediately at a glance if you're subject to risk sharing and the amount. The last line, along these episodes of care, you are subject, it'll give you a summary that you are subject to risk sharing and that stop loss was applied in the amount of the risk sharing that you're subject to. The first thing I'd like to call your attention to on this report summary page, notice it says ADHD Level 1 closed episodes. So the data on this page is only going to be data from closed episodes, none of your open episodes. You'll notice it says total number of episodes in the overview section is 262, but the total episodes included is only 233. So you had 29 episodes that were excluded, and there's a number of reasons they could be excluded, such as a comorbidity or the age of the beneficiary. Section 2, in the cost of care compared to other providers, you were the darker blue diamond, and all other providers are the light blue triangle. It will give you commendable to non-acceptable range. And in this example, the provider falls into the acceptable cost range and is not subject to gain or risk sharing, and it tells them that. The third section is the quality summary. Now, since this is an historical data, there's not going to be any quality metrics to track, but as you go to future reports, it will be a bar graph similar to this, and it will be in this section, and it will show you where you are in your quality metrics, if you're pass or fail, and how far above the line you are. So be watching for that in the coming reports. Now on this side, it's going to show you episodes that we are tracking, but they're not linked to gain share. And these are tracked to claims data, and again, not linked to gain share. However, remember, on this side, the ones that are linked to gain sharing, if you do not pass your quality metrics or meet the quality metrics, you will not be able to participate in gain share, even if you are in the commendable range for cost. So it's very, very important that you remember to go into the portal and complete all the certifications for your quality metrics. The next section is the cost summary. There's several graphs in here in this section of the report that I think will be useful to you in assessing your performance. The first graph is your total cost overview. The graph next to it is the average cost overview and compares your average cost to that of other providers. So this is you, and this is your non-adjusted cost. This is your adjusted cost. But now when we go over here, it's comparing you to the other providers. So you've got your cost compared to other providers. In this example, your cost is $2,000 compared to all providers, which was $1,750. Not a whole lot of difference, but just a little bit of difference here. This second section, I think, is real important when you start looking at your cost and where you may need to go into a little bit more detail into your cost. This shows your cost distribution. In this example, the provider had, we'll just look at it, had 23 beneficiaries in the $700 to $1,547 range, which was in the commendable range in green, and 23 beneficiaries in the $2,223 to $10,157 range, which is in the non-acceptable range. You'll notice that most of them, he had 84 beneficiaries in this acceptable range in the middle. So looking at this graph on your report, it'll kind of help you see where the majority of your beneficiaries are falling, and you may want to take a look at the ones that are falling into the higher cost range, and you delve into a little bit more detail on those patients, and you'll be able to see that in the detailed portion of the report. The last graph in this section shows the provider where they fall in the distribution range of provider average cost, and it's very hard to see on this slide, but there is a blue mark in here that it's a blue line in the graph kind of halfway through, and it will show in the acceptable range. Hopefully we can make that a little darker, but when you look at it on your computer or you print this out, you can see that blue line a little bit better. Section 5 on this report is the key utilization metrics. This section gives you some key metrics to use to see your performance compared to other providers. The provider is shown again in the dark blue and all other providers in the light blue. The first one is the average number of visits per episode. And you'll see in this example, the provider had 4.1, where all other providers had 3.9. Very, very, very close. But let's look at this slide. Notice in this example is the average number of psychosocial visits per episode. In this example, the provider had almost double the number of visits than all other providers. So again, here's somewhere where you may be able to look if you are falling into the non-acceptable range of cost. Just another place where you can kind of delve into maybe where some of your costs lie. The next page is an additional graph with percentages that shows your quality and utilization records. For example, if we were in the performance level and we were able to track your quality certifications for quality metrics, it would be highlighted in this blue line, and you'd see that. Again, you'll see where you fall percentage-wise with other providers and your utilization metrics as well. The next page of the report is the cost detail, and can provide you with a more detailed insight of your cost distribution. It is broken down into the major care categories for the episode, such as pharmacy and outpatient professional. This report also shows how your costs compare to other providers. Again, this section of the report can assist you in seeing where you are doing well or where improvements could be made to improve your performance. It goes anywhere from your emergency department, your outpatient lab, anything that could be included in the cost of care. And again, your total number of episodes included in this is 233. Again, only for your closed episodes. You will see if you have a level 2 patients, you're going to see a report similar to these last 3 pages for level 2. It's the same formatting, but it'll have level 2 closed episodes. So you're going to have a separate report for level 1 and a separate report for level 2. Following this, you're going to, of course, have your glossary of terms, but then you're going to have your detail, and it's going to give your patient, your beneficiary detail. For these, it's going to tell you the patient's name, the date of the episode, their average non-adjusted cost and their cost, and then it's going to break it down by care category and number of visits. So you're going to be able to, when you go in that graph and you see some of these high-dollar patients that are in the non-acceptable range, you're going to be able to go through here and say, okay, we're exactly where their cost for these particular patients. And then these are for the closed episodes. And if you will keep scrolling, here's the level 2 closed episodes. And if you will keep scrolling on your historical performance, here's your level 1 open episodes. Now, when you look at these, the first thing that you really want to do is make sure that every one of these patients are certified, have the certifications in the portal. Very, very important if you want to participate in gain sharing. You may see a patient on your open episodes one quarter and not see them on the next quarter, and they can fall off for several reasons. One, they've moved from level 1 to level 2, or they're seeing another provider, and that provider has become the PAP for that beneficiary, so they're going to fall off of your report and go on to the other PAP report. Again, please make sure that the quality metrics are entered in the portal.